reports. Oh, okay, hold on. I think I'm just going to click, got it here. And I'm so excited to have you guys here today to talk through MassHealth renewals. And yeah, thank you so much for being here. And we can go to the next slide, Maddie. Today, I am going to speak to what a MassHealth renewal is, discuss why it is especially important this year, and give you guys some real concrete information about what you can do to help support the members you serve in preparing for and understanding how to complete renewals, and really focus on some specific considerations for our members with disabilities. Next slide. Who this information is for. This information is for folks who are working with our MassHealth members in the community. It's intended to give you guys some helpful tips about how you can help our members maintain their MassHealth eligibility. There's no implication that by going through this presentation, you have access to a member's private health information. However, if you would like to access a member's health information, or if a member would like you to, there is information about how you could become a certified assistance counselor in this presentation, and also some information about if a member would like to designate you as an authorized representative, how you can do that. Next slide. So what is a MassHealth renewal? Federal law requires MassHealth to check whether a member is still eligible for MassHealth. We refer to this check as a renewal. Sometimes we call it an annual review. We also refer to it as a redetermination. Renewals generally need to occur every year. And for the last several years, MassHealth members receive their renewal forms in the mail. Renewals occur at the household level and are sent to the head of household. Many members will be automatically renewed. This means that MassHealth will automatically process a member's renewal by matching their information against state and federal data. If the information matches, and MassHealth may not need any more information and no action is necessary. And we're going to talk a little bit more about that in a couple slides. If MassHealth does not have enough information to automatically renew a member, members will need to report new information, and they will get a renewal form in a blue envelope. So I do, in this slide presentation on slide 10, there is a image of that blue envelope that I will show you guys. That will be really helpful to you. Okay, we can go to the next slide. So the reason we're talking about renewals this year is because at the beginning of the COVID-19 public health emergency, the federal government implemented continuous coverage requirements. In response to these requirements, MassHealth put protections in place that prevented members' coverage from ending. So those protections have been in place since February of 2020 for a little over 3 years. And the continuous coverage requirements end on April 1, 2023. So MassHealth is restarting our standard eligibility renewal process. All of our members will be renewed to ensure they still qualify for their current benefit. However, like we talked about, there will be members who will be automatically renewed. And I'll get into that a little bit more in the next slide. Renewals for our MassHealth members will take place over the next 12 months. We'll start in April 2023 and we'll go through March of 2024. This means our MassHealth members could get their renewal forms in the mail at any time during this 1 year period. So I've heard it said before, and I'm going to say it, this is a marathon, not a sprint. Not everyone will be receiving renewal forms. Come April 1, it could be at any time during this 12-month period. Next slide. So this is a note on automatic renewals. As I stated before, whenever possible, MassHealth will attempt to automatically process a member's renewal through multiple avenues. One of those avenues is MassHealth will automatically process by matching a member's information against state and federal databases. We also have certain members who belong to the following categories who may be automatically renewed. This includes members who are receiving SSI through the U.S. Social Security Administration because they are 65 and older and have limited income and resources, or because they are disabled and have limited income and resources. It includes members who are receiving temporary assistance of needy families through the Department of Transitional Assistance, and members who are currently or formerly in the custody of the Department of Children and Families. However, I do want to note, if these members do receive a blue envelope with a renewal notice or any other mail from MassHealth, they must respond. But in general, these folks will be automatically renewed and will not receive a blue envelope. Next slide. And as we talked about, I'm going to really highlight a few areas that you, as folks in the community meeting with our MassHealth members, can help members stay covered. The first is to help members prepare for their renewals. And we can go to that next slide. So the number one is when you're interacting with members one-on-one, remind them to report all changes to MassHealth, remind them to update their contact information with MassHealth, and read all mail that is coming from MassHealth. And let them know that you can come and help them understand their mail when it does come from MassHealth. In spaces where members visit, if you do happen to have a physical location where members come to, you could post a flyer about MassHealth Renewals to let folks know it's coming. And MassHealth has produced this really fantastic phase 1 toolkit that has flyers specifically for this purpose. And I also want to highlight that we just are live with the phase 2 toolkit, which later on in the slide deck, there'll be a link to, and has downloadable flyers, posters, and other materials in 9 languages, and also has specific information for members with disabilities and older adults. In your member-facing communications, whether it be newsletters or emails to members, it would be great to put information about MassHealth Renewals to let folks know this is coming. Again, in the phase 1 and phase 2 toolkits, there is sample language. And I want to say this slide deck will be sent to all, and there's so much information in here, so please use it as a resource. There's live links throughout. Okay, next slide, please. Thank you. So this is how do you help a member update their information? We're telling you, let folks know to update it. Here are the easiest ways for people to update their information with MassHealth. For our members under age 65 years old, their HIX account is the easiest way to update their contact information. If they don't have an account, you can help them create one by following the link on the back of their MassHealth notices, or by calling this phone number, which is 844-365-1841. For all of our members, whether 65 and older or under 65, they can call MassHealth customer service at 800-841-2900. Or members could get help from a certified application counselor or navigator. And in a few slides, I'll give you more information about the certified application counselors and navigators, but there's a link here that can direct folks to the CACs and navigators. Next slide. And here is one of my favorite slides in this slide deck, which is an image of the blue envelope. So this is what members will be sent and will contain the MassHealth renewal information. However, for folks who are being auto-renewed, who we spoke about before, they will not receive this blue envelope, but they will get a notice in the mail letting them know they have been auto-renewed. Okay, next slide. So how can you help MassHealth members when they do receive their renewals? You can help them read and understand the mail they receive from MassHealth. You could help translate, or if they're vision impaired, help them request large print or braille notices. You could walk through the notices with them, circle the date that they need to renew by, and walk them through instructions and make sure they understand what action they need to take. You could also help members make a concrete plan and help them decide how they're going to complete their renewal, whether it would be online, over the phone, or on paper. And you could also connect them with support resources. If there's an area that a member is asking about that you cannot answer, you can connect them with the MassHealth resources that exist to support them. And again, in a couple slides, I'm going to be talking through each of these resources. And the resources include the MassHealth Enrollment Centers, the Certified Application Counselors and Navigators, and the MassHealth Customer Service Center. Okay, next slide. And here's some more details about how to help members complete their renewals and how a member can complete their renewal. For members aged 65 and under, you could help, I'm sorry, it's not 65 and under, it's under 65, so 64 and under. You could help a member go online to the HICS system to submit their renewal. And this is the easiest way to submit a renewal. For members over 65, residing in a nursing facility or in a home and community-based services waiver, the member will be able to e-submit their renewal. A little different from the HICS online renewal, but they will still have an option to submit their renewal online. And the link for the e-submission is right here. Or members can complete their applications and mail back to the Health Insurance Processing Center. Members can call the MassHealth Customer Service Center to complete their renewal over the phone, or members can schedule an appointment with a MassHealth representative. And in both of these, there is a link where members can schedule an appointment to complete their renewal form with a MassHealth representative. It can be done over the phone, with online or like a video, or in July, there can be an in-person scheduling. Okay, and next slide. So I'm going to talk quickly through the overview of timelines for renewal. So like I've said a couple times, whenever possible, MassHealth will automatically process a member's renewal. But if MassHealth can't automatically process a renewal, the member will receive a blue envelope in the mail with a renewal form to complete and return to MassHealth. Typically, the member will have 45 days to respond to the renewal notice. Folks who are in a long-term care facility typically have 30 days to respond. If members respond to renewal notices, but MassHealth still needs more information from the members will have an additional 90 days to respond. And we refer to that as the request for information. Hopefully this all works out and members will receive their MassHealth approval notices and everything will be all set. However, if folks don't respond, they will receive a termination notice. And typically members will be given at least 14 days after receiving a termination notice before their MassHealth benefits stop. During the reconsideration period, a member who has been closed for failure to respond can contact MassHealth to complete their renewal and will be reinstated to the day they were closed, as long as they contact MassHealth within 90 days of their MassHealth coverage terminating. So if a member either didn't receive or just didn't respond to the contents of the blue envelope or to the request for information, as long as they reach out to MassHealth within 90 days of the MassHealth coverage terminating, they can be reinstated. Okay. Next slide. Okay, great. And this is the slide that lists the resources that exist to help members with their renewals. The first one is the MassHealth Enrollment Centers. The MassHealth enrollment centers provide members with phone, virtual, or in-person assistance with their application from MassHealth staff. And we're recommending that folks schedule an appointment ahead of time. And this is the link that was on that previous slide. And there are 6 MassHealth enrollment centers across the state, and you can find the nearest one at this link right here. There's also certified application counselors and navigators. And TACs and navigators are community-based resources that help members apply for and renew their health insurance benefits. They're trained by MassHealth, but are not MassHealth staff. Help from certified application counselors and navigators is free, but it may require an appointment. And again, at this link right here, you can find the nearest organization. The third resource is the MassHealth Customer Service Center. If members have questions about their MassHealth renewal that you cannot answer, you can have them call the MassHealth Customer Service number. And the phone number is 800-841-2900. And assistance is available in a wide variety of languages. And callers may request a translator at any time. Next slide. And here is a slide just around some of our language and translation supports. For the toolkit that we touched on earlier in this presentation, it is in several, there's materials in several different languages listed here. Community outreach through Healthcare for All will include local language and local language television and radio stations. We are issuing grants to community-based organizations, including those focused on immigrants and refugees. And MassHealth will publish vlogs incorporating ASL and offer live ASL translation during webinars. Translation services. Renewal forms will be mailed in English or Spanish and are available in large print or Braille. Renewal packages also include Babel notices, which list a whole bunch of languages that indicate key information can be translated for members. For members who require translation of forms, they can receive free translation services through the MassHealth Customer Service Center. And again, the Customer Service Center has representatives who speak a wide variety of languages, and there's also language line services available. The certified application counselor list will be indicating which languages are spoken. I don't think that's quite live yet, but will be. We're hosting enrollment events with on-site translators. And for individuals who speak ASL, MassHealth offers on-demand VRI in person at the MassHealth enrollment centers. Next slide. So our health plans at MassHealth are also reaching out to members and providing support for renewals. Our health plan partners include our ACOs, MCOs, senior care organizations, One Care plans, and PACE organizations. The plans are actively outreaching and assisting their enrollees to keep them informed about when they will be receiving their blue envelopes and making sure that they are submitting information back to MassHealth to maintain their MassHealth coverage. So MassHealth is actively sharing information with our plan partners around when a member is being sent their blue envelope. And our plan partners are conducting calls, emails, texts, outreach to their members. Next slide. So if a member no longer qualifies for MassHealth, you can help direct them to find affordable healthcare coverage. For members under 65, affordable plan options are available through the connector. And also it's important to note that losing MassHealth coverage is a qualifying life event, which allows members to enroll in a plan through the healthcare connector outside of the open enrollment period. For members over 65, there are many other affordable options available. They're all listed here. And but there's other programs within MassHealth that a member may qualify for based on their circumstances. Next slide. So this slide just touches quickly on some special considerations for people with disabilities preparing for renewals. The first is agreements to share information. Members may have someone in their lives who they would like to help assist them with managing their MassHealth. And in order for MassHealth to be able to share information with someone, MassHealth needs to have either a permission to share form or an authorized representative designation form on file. I actually have another slide in a few, not the next slide, but the slide after, that talked through each of these forms. But here are the links here for these forms. But the other slide gives a little bit more information about the differences between these two. But the permission to share information form allows MassHealth to share information about a member's eligibility with the person listed on the form. The authorized representative designation form allows MassHealth to share information with the person listed on the form and for that person to make decisions on behalf of the member. Accommodations. MassHealth has accommodations for older adults and people with disabilities. These accommodations include a disability ombudsman who can provide personal assistance by explaining MassHealth processes and requirements and helping MassHealth applicants or members fill out forms over the phone. So the contact information for a disability ombudsman is right here in this slide. We also have a TTY TTD phone number for members who are deaf and hard of hearing. Again, we have the option to request large printer braille forms by calling MassHealth customer service and touching again on the video remote interpreting and assisted living devices at all of our MassHealth enrollment centers. I'm going to skip over this last section here because we have a whole nother slide on this, which is next. So we can go to the next slide. So will a MassHealth's redetermination require them to renew their disability determination? So that actually depends upon how a member's disability is determined and who it was completed by. So if a member's disability determination was determined by the Social Security Administration or the Massachusetts Commission for the Blind, the member's disability review will be done by the Social Security Administration, and that is completely separate from the MassHealth renewal. In Massachusetts, the MRC Disability Determination Services, and in this MRC stands for the Massachusetts Rehabilitation Commission, performs the continuous disability review or the continuing disability review on behalf of the Social Security Administration. If members have questions about this process, they should contact the Massachusetts Rehab Commission's Disability Determination Services number here, listed here at the bottom of the slide, or contact the Massachusetts Rehab Commission's ombudsman at this number listed here. If a member's disability determination was completed by the Disability Evaluation Services at UMass Medical School, the member may need to complete a disability evaluation form. Their disability is completed by DES on behalf of MassHealth. This process is also called a continuing disability review. If a member needs to complete a continuing disability renew, it will be mailed to them and will arrive at a separate time from the member's MassHealth financial review, which will come in that big blue envelope. Whether a member will receive a continuing disability this year depends on several factors, including the expected date of the expected end date of their disability and the date on their most recent review. If they need to complete a continuing disability review, they will receive a notice in the mail. If they completed a review during the public health emergency and either self-attested to their disability or received administrative approval, they should expect a disability review this year. And as a note, children who are under 18 do not need to complete a review until they turn 18. Where to get help? If people have questions or need help with their disability review, they should contact the DES helpline, and the number is listed here at the bottom of the slide. Next slide. Yes, and on this slide, this slide speaks a little bit more to the permission to share information form and the authorized representative designation. And I think we actually talked most things on this slide, so we can go ahead to the next slide. So other ways you can help. You can sign up for the MassHealth Eligibility Redeterminations email list, which the link is listed here in this deck. You can join the MassHealth Healthcare Training Forum email list and attend trainings. And again, the links are here. Or you could become part of the CAC program. As we talked quickly about what CACs do, we are really interested in having any organization become a CAC organization. So if you're interested, you can email at the email address listed here at the bottom of the slide. Next slide. Don't worry, we're getting close here. The MassHealth Renewal Guide, which has just came out this past Friday, is a fantastic tool that MassHealth has put together that gives some really, really incredible information when you are helping members complete their renewals. The link is listed right here at the bottom of this slide. And the next slide this is the link for our MassHealth Renewals website. And one more slide gets us to the phase 2 redeterminations outreach kit. Here's the link here at the bottom of this slide, where I told you there's some fantastic materials for you to share with your members. And next slide. Final tips and reminders. If members are under 65, the fastest and easiest way to renew their coverage is online using their HICS account. If members are over 65 in a nursing facility or home and community-based waiver, e-submission is the fastest and easiest way to submit their renewals. Remind your members as you're meeting with them, if they've moved, changed jobs, or had changes in their household over the past 2 to 3 years, to contact MassHealth to provide them with this information. And due to the large number of renewals this year, members may have longer than usual hold times at MassHealth customer service. And members may not get their renewal forms right away, but should be on the lookout from now until April 2024. And use the resources to help members, including the MassHealth enrollment centers, the customer service centers, the CACs and navigators. And finally, just thank you so much for your attention to this and for helping to get the word out to our members. And next slide, I think we are at questions. Thank you so much.